Hello folks, and welcome to Chapter 7 of your phlebotomy course. Today we'll be discussing the circulatory system in depth, which is very important to understand the anatomy and physiology of the circulatory system, being that this is the major organ system that you'll be dealing with as phlebotomy technicians. So the circulatory or cardiovascular system is made up of the heart, blood vessels, and blood. A healthy circulatory system is essential for life. Phlebotomists are responsible for drawing blood from patients, so it's important that they understand basic facts about how the circulatory system works. So the heart is located between the lungs, and its center is just left of the midline of the body. The top of the heart is known as the base, and it points towards the right shoulder. The bottom of the heart, known as the apex, points towards the left hip. The heart can be described as a double pump, pumping deoxygenated blood into the lungs and pumping oxygenated blood into the body. The right side of the heart receives deoxygenated blood from the body through the veins and pumps it into the lungs. In the lungs, the blood receives oxygen again. The left side of the heart receives the oxygenated blood from the lungs and pumps it out to the body through the arteries. The right and left sides of the heart are separated by a wall called a septum. The heart has two upper chambers called the atria. A singular would be called atrium, and two lower chambers called the ventricles. So the atria you can think of as the receiving chambers, the ventricles you can think of as the shipping chambers. The chambers contract and relax in a rhythmic pattern to produce blood flow. The atria contract while the ventricles relax, and the atria relax while the ventricles contract. So this back and forth action between the upper and lower chambers allow the chambers to fill with blood before they contract to pump the blood. Blood always flows through the heart through a distinct path. First, the right atrium receives deoxygenated blood from the body and pumps it to the right ventricle. The right ventricle pumps the deoxygenated blood to the lungs through the pulmonary arteries. The lungs oxygenate the blood, which then returns to the heart through the pulmonary veins. The left atrium receives blood from the pulmonary veins and pumps it to the left ventricle. The left ventricle pumps oxygenated blood out of the heart via the aorta, which is the largest artery in the body. A series of valves ensures that blood flows in the correct direction as it's pumped through the heart. The four major valves of the heart are the tricuspid valve, the pulmonary valve, the bicuspid valve, and the aortic valve. During a normal heart cycle, the tricuspid and bicuspid valves will be closed, and the pulmonary and aortic valves will open when the ventricles contract. So just to recap some of the major points about the anatomy of the heart system, remember the following points about the function of the circulatory system. The major components are the heart, blood, vessels, and the blood. Pumps blood through the arteries to the cells, providing oxygen, nutrients, and unnecessary substances, and carries waste products away from cells in the veins, and it's essential for life. We're going to talk about this a little bit more, but the heart is a double-sided pump. Deoxygenated blood is pumped into the lungs, which is referred to as the pulmonary circulation, and oxygenated blood is pumped through the body, which is referred to as the systemic circulation. And just to go over and review and recap the blood flow through the heart, it travels in a distinct path. The right atrium receives deoxygenated blood and pumps it to the right ventricle. And try to follow along with the diagram here. The right ventricle pumps deoxygenated blood to the lungs through the pulmonary arteries. Lungs oxygenate the blood and return it to the heart through the pulmonary veins. The pulmonary veins return oxygenated blood to the heart through the left atrium, which receives the blood from the pulmonary veins and pumps it to the left ventricle. The left ventricle pumps oxygenated blood out of the heart through the aorta. The aorta is the largest artery in the body, and the heart valves ensure that blood flows through the heart along the correct path. In order for the heart to pump throughout the body, the heart muscle and valves must be healthy, and there must be enough intact system of blood vessels. There's also another essential factor in proper heart function. A system of specialized cardiac tissue capable of generating electrical signals. The action of the heart muscles are prompted by electrical signals. Specialized heart tissue begins or initiates these electrical impulses, then conducts or carries them through the heart. These impulses are what's considered the spark that triggers the mechanical action of the heart muscle. This network of signal conducting tissue is known as the cardiac conduction system. The cardiac conduction system begins the upper part of the right atrium and continues through the heart to the walls of the ventricles. The sinoatrial node, sometimes called the SA node or sinus node, is the upper part of the right atrium and is the main pacemaker of the heart. This means it sets the timing for the heart's contractions. From the SA node, the electrical impulse travels to the atrioventricular node, also known as the AV node, at the bottom of the right atrium, behind the tricuspid valve. As the impulse enters the AV node, it's slowed down slightly. Without this delay, the atrium ventricles would contract at the same time. Instead, this delay allows the atria to empty of blood and the ventricles to fill before they contract. The electrical impulses that travel through an area known as the atrioventricular junction to the bundle of His, or the AV bundle. The bundle of His is located in the upper part of the wall between the left and right ventricles. Fibrous connective tissues surround the conductive tissue in the bundle of His and make sure that the impulses travel to the correct route. The bundle of His divides into the right and left bundle branches. These branches carry the electrical impulse to the walls of the ventricle. The bundle branches continue to divide into smaller branches and then form what's called the Purkinje fibers, which then ultimately allow for the electrical activity that allows the heart to contract. You'll discuss more of this in depth and in detail, if you haven't already, when you take BI 452 EKG technician class. So just remember the following points about the cardiac conduction system. The actions of the heart muscles are prompted by electrical signals. Specialized heart tissue begins electrical impulses and carries or conducts them through the impulses through the heart. These electrical impulses are the spark that triggers the heart muscle's contraction. Cardiac conduction begins in the upper part of the right atrium and continues through the heart of the walls to the ventricles. The sinoatrial node is the main pacemaker of the heart, setting the timing of the heart's contractions. Signals travel downward through the heart with a delay at each point to allow the blood to move before the next contraction comes. There are two major veins that carry blood back to the right side of the heart. One is called the inferior vena cava, inferior meaning below, which carries blood from the legs and the trunk, and the superior vena cava, which carries blood from the arms, head, neck, and empties into the right atrium of the heart. The structure of veins and arteries are somewhat similar. However, arteries have thicker walls to withstand the pressure of the beating heart. When felt through the skin or palpated, the word palpate means to examine the body by using the fingers or hand, arteries feel stiff and firm. It's also possible to feel the pulsing of blood through the arteries when the heart beats. Veins have thinner walls, and many veins also have internal valves that help keep blood moving in the right direction, back towards the heart. When palpated, healthy veins feel more like springy or bouncy than arteries, and there's no pulse present. The walls of veins and arteries are composed of three layers: an outer layer called the tunica adventitia, a middle layer called the tunica media, and an inner layer called the tunica intima. The middle layer, which is composed of muscle tissue and elastic fiber, is considerably thinner in veins than it is in arteries. The thinner walls of the veins increase their capacity to hold blood. At any given time, about 70% of the body's blood volume is found in the veins. The blood vessels of the body circulate blood between the heart and the lungs, called the pulmonary circuit, and between the heart and the rest of the body, called the systemic circuit. After the vena cava deliver oxygenated blood to the right atrium, the blood flows to the right ventricle. There it is pumped to the lungs through the pulmonary arteries, the only arteries in the blood that carry deoxygenated blood. At the end of the respiratory tract are tiny elastic sacs called alveoli that are surrounded by capillaries. Oxygen and carbon dioxide are exchanged between the alveoli and capillaries. Oxygenated blood goes from pulmonary capillaries to venules. Then it travels the pulmonary veins, which are the only veins in the body that carry oxygenated blood, before arriving at the left atrium. The systemic circuit is the constant closed circuit that delivers substances needed by the cells and removes waste products at exchange sites throughout the body. It begins when the left ventricle pumps blood to the aorta. That blood is eventually returned to the right atrium through the superior and inferior vena cava. And again, try to follow the diagram that you see along with the slide. So remember a few points about the blood vessels in the arteries. The aorta is the largest artery in the body. All blood exits the aorta as it's pumped out of the heart. A number of arteries pass through the inner elbow where blood is usually drawn. Chapter 9 covers the anatomy of this part of the body in greater detail, but the phlebotomist needs to be aware of the arteries to avoid nicking them when collecting blood. Arteries have thicker walls to withstand the pressure of the beating heart, and they feel stiff and firm when palpated. A pulse can be detected when palpating an artery. Remember, arteries branch into smaller blood vessels called arterioles, and then arterioles branch into the smallest blood vessels called capillaries. Capillaries feed into small venules and then veins and converge. Exchange of oxygen, carbon dioxide, nutrients, and waste products all take place in the capillary beds. The average healthy adult has 5 to 6 liters of blood, consisting of a liquid component called plasma and solid components called formed elements. Blood transport gases, nutrients, wastes, and hormones throughout the body. It also protects against infections, forms clots to stop blood loss in case of an injury, regulates body temperature, and helps the body maintain homeostasis. About 55% of the blood volume is made up of plasma, which is clear, straw-colored fluid. Plasma is about 90% water and about 9 to 10% dissolved substances, including proteins, gases, hormones, and nutrients. Some of the proteins in the plasma are important for proper blood clotting. Formed elements make up about 45% of the blood volume and include red blood cells, otherwise known as erythrocytes, several types of white blood cells, also known as leukocytes, and platelets, which are also known as thrombocytes. Erythrocytes contain hemoglobin, a protein that transports oxygen and carbon dioxide. Leukocytes protect the body against foreign substances such as bacteria and viruses, and thrombocytes or platelets play a role in blood clotting. While erythrocytes are the most common of the blood cells, they make up about 40% of total blood volume. They're generated from stem cells, or cells that can become any type of cell in the bone marrow. They mature over the course of about 7 days and live for approximately 120 days. They're disc-like with a center indented on both sides. It's kind of like the shape of a bialy. Their shape allows them to bend into and fit into blood vessels of all sizes. Some capillaries are so small that erythrocytes must go through them one by one, or even distort themselves in order to fit. Leukocytes are much fewer in number, accounting for about 1% of total blood volume. There are several different types of leukocytes. The most common is the neutrophil. Neutrophils make up approximately half to about 2/3 of total number of white blood cells. Neutrophils are also generated from stem cells in the bone marrow, and they are the body's first defense against illness. Related to neutrophils, but less numerous, are eosinophils and basophils. Together, these type of white cells make up what are called granulocytes. Granulocytes are very short-lived. Any given cell lasts less than a full day, so they have to be generated and regenerated constantly. Approximately 20 to 30% of white blood cells are lymphocytes. They play a number of roles in boosting the body's immune system. These cells also originate in the bone marrow. Some remain in the marrow and mature into a type of lymphocyte known as a B cell, and some move on to the thymus, which is an organ that's located in the lymphatic system, to become T cells. Some type of T cells give chemical signals to the body to regulate the immune responses and fight infected cells directly. B cells, with the help of signals from T cells, produce antibodies. Antibodies bind to things called antigens, or proteins that mark foreign substances and cause an immune response. Lymphocytes circulate in the blood and are also present in high concentration in the lymph nodes, tonsils, and spleen. Most lymphocytes live only a few weeks, but some can live for years. This provides the body's immune system with a memory of antigens it has encountered in the past, and it allows for a more rapid response when the body is exposed to them again. Up to about 10% of white blood cells in the human body are called monocytes. After entering the bloodstream from the bone marrow, monocytes move to tissues throughout the body. There they mature further into cells called macrophages. Macrophages eat invading or foreign microorganisms by surrounding them and breaking them up. They are the largest of the leukocytes. Thrombocytes are not actually cells, they're cell fragments. Large cells called megakaryocytes are produced in the bone marrow, and these cells fragment into platelets. Platelets are very important in the beginning stages of blood clotting. So, to sum this up with the phlebotomist's point of view and make the connection to phlebotomy, there's a test called the complete blood count, or the CBC. It's a common test used to check for the composition of the patient's blood. It allows the doctor to determine how many red blood cells, white blood cells, and platelets are in a patient's blood. In some variations, the test may further measure how many of each type of white blood cell is present. This is called a complete blood count with a differential. Anemia is a condition in which a person has either too few red blood cells or too little hemoglobin in the blood. A CBC may be used to determine the presence of and what type of anemia a patient may have. So just to recap, remember the following points about blood. An average healthy adult has about 5 to 6 liters of blood. Blood transports gases, nutrients, wastes, and hormones throughout the body. Blood also protects against infections, forms clots to stop blood loss in case of injury, and regulates body temperature while also helping the body to maintain homeostasis. Each part of the formed elements is different. Erythrocytes contain hemoglobin, a protein that allows them to transport oxygen to the body cells to carry oxygen and carbon dioxide. They make up about 40% of the total blood volume. They're generated in the bone marrow. They're disc-like shaped, and they bend and fit into blood vessels of all sizes. Leukocytes, or white blood cells, protect the body against foreign substances, and they make out about 1% of the total blood volume. Before we continue with segment 5 of this chapter, let's go over some common definitions. For example, blood type refers to a designation based on the presence or absence of specific antigens on a person's red blood cell, designated A, B, AB, and O, which are the most common. The ABO blood group system classifies blood type based on the presence or absence of A and B antigens on a person's red blood cells. The Rh factor is a protein that also may or may not be present on a person's red blood cells. If a person is Rh positive, this is a designation for people who have the Rh factor on their red blood cells, whereas Rh negative is a designation for people who do not have Rh factor on their red blood cells. And these designations are very important in the event that a person may need a blood transfusion or transfer of blood from one person to another. The surfaces of red blood cells have certain antigens, in other words, substances that cause an immune response attached, and these differ from person to person. The presence or absence of a specific antigen is tested to determine a person's blood type. The antigens most commonly present on a red blood cell are known as A antigens and B antigens. People may have one of these antigens, both of these antigens, or none of them. And as mentioned before, blood type is determined based on the type of antigens present on the person's red blood cells. If you see type A blood shows those little circular proteins on the edge of the surface, which are A antigens. Type B blood shows by diagram the little triangular proteins, which are the B antigens. Type AB blood contains both antigens, both A and B. And then finally, type O blood has neither one of those proteins and will not elicit an immune response. So these are the antigens and antibodies involved in the most common blood types. People with blood type A have A antigens. Because the body of a person with type A blood recognizes A antigens as part of itself, it does not create antibodies to attack them. It does, however, create antibodies to attack B antigens, called anti-B antibodies. People with blood type B have B antigens with anti-B antibodies. People with both A and B antigens are said to have type AB blood. Because their bodies recognize both A and B antigens as self, they do not possess anti-A or anti-B antibodies. Individuals with neither A nor B antigens have type O blood, and they have both anti-A and anti-B antibodies. Refer to the previous figure. This system of classifying blood is called the ABO blood group system. Another variation in red blood cells involves the presence or absence of a protein called Rh factor. Individuals who have Rh factor on their red blood cells are said to be Rh positive. Those who do not have the protein are considered Rh negative. Negative or positive is usually attached to the description of a person's blood type to indicate absence or presence of Rh factor. For example, a person with O positive blood has type O blood with the Rh factor present. Rh factor and blood type are generally determined, meaning a person's blood type are genetically resulted. This means a person's blood type results from a combination of genes passed down from both parents. While people with A antigens naturally possess anti-B antibodies and vice versa, people who are Rh negative do not naturally possess anti-Rh antibodies. They only develop these antibodies when their blood is exposed to Rh positive blood. This can happen in the case of a transfusion. In other words, if I transfer of blood from one person to the bloodstream of another, from an Rh positive donor, or in certain situations when an Rh negative woman is pregnant with an Rh positive fetus. The first time an Rh negative person's blood encounters Rh positive blood, the resulting reaction is generally mild. The antibodies have not yet developed in great number. The second time, however, dangerous or even fatal complications can occur. In the case of a mother and fetus or infant, a second Rh positive child is at a greater risk than the first. Because of this, women are tested for blood type and Rh factor early in pregnancy. Medicine can be given to the mother to suppress her body's response to Rh factor, and the fetus can be monitored for signs of red blood cell destruction. Before a person receives a blood transfusion or an organ transplant, their blood is tested for blood type and for the presence of Rh factor. Because of the antibodies that are present with certain blood types or that may develop in Rh negative recipients, not all blood can be transfused to all people. For example, a person with type A blood possesses anti-B antibodies, and so cannot receive type B blood or type AB blood. Further, if the recipient is Rh negative, the donor blood must also be Rh negative. The table that you see in front of you, 7-1, summarizes the donor and recipient restrictions for each blood type. So Because AB blood type, Rh positive individuals can also receive blood from any ABO or Rh type negative. They are also known as universal recipients. Because O blood type, Rh negative individuals can donate blood to any ABO or Rh type. They're also called universal donors. So just to recap, remember AB positive individuals can receive transfusions from any donor, and they are known as the universal recipients. O negative individuals can donate to any ABO Rh type. They are known as universal donors. O blood groups are the most common. O positive is much more common than O negative. A positive is also very common. So it's essential to understand blood type and perform careful patient identification. These are one of the most critical errors that can occur in the field of phlebotomy. Errors in patient identification or specimen labeling can be deadly where blood transfusions are concerned. Transfusion of even a small amount of wrong type of blood can trigger reactions that can lead to serious damage or death. So although all blood in the body has the same basic composition of plasma and formed elements, blood found in different types of blood vessels will have different qualities. So just to review some following terms, arterial blood is blood found in the arteries, oxygenated usually and marked by a brighter red color. Venous blood is blood found in the veins and it is usually, for all purposes, deoxygenated, dark and deep red color. A syringe is a tubular device with a plunger that, when pulled, acts to draw in fluid, for our purposes blood. Capillary blood is blood in the capillaries, which contains both arterial and venous blood, and its color is somewhat between both bright and deep red. Blood in the arteries, or arterial blood, has been pumped out from the heart to be carried throughout the body. With the exception of blood in the pulmonary arteries, arterial blood is oxygenated. Oxygen is transported by the protein hemoglobin, which is present in the red blood cells. Hemoglobin contains iron and gives blood its red color. Oxygenated arterial blood is bright red. Arterial wounds can bleed forcefully, possibly spurting and spraying due to the pressure created by the beating heart, which in itself can be actual life-threatening. Although blood in the veins or venous blood is usually depicted as blue in illustrations and may appear blue under the skin, it's actually not blue at all. Veins return blood to the heart, and in all cases other than the pulmonary veins, they carry deoxygenated blood. The color of this blood is darker, deeper red. The blue color of veins under the skin is a trick of light, and when venous blood flows into the collection tube, its deep, nearly maroon color is usually visible. Venous blood does not flow with the same amount of pressure of arterial blood. It does not spurt or pulse when a vein is branched. In fact, taking venous blood from a patient requires some amount of force to pull or draw the blood from the veins. Venous blood is usually collected either in a tube emptied of air to create a vacuum that draws in the blood, or through the use of a syringe, which is a tubular device with a plunger that draws blood from the veins when pulled. The capillaries are the smallest blood vessels in the body. They are the exchange sites between veins and arteries. Capillary blood contains a mixture of arterial and venous blood. Nutrients and wastes are also exchanged in capillary beds, so capillary blood will also contain these substances. Its color is somewhat between the bright red of arterial blood and the deep red of venous blood. So to get through and understand the phlebotomy process, the phlebotomy student has to have a thorough understanding of various dry definitions and terms that are going to be used over and over again in the course of conversation of their profession. To start off with, the term thrombosis is simply the formation of a clot within a blood vessel. It's a blood clot. Hemostasis. Okay, hemo refers to blood, stasis refers to stoppage. It's the stopping of a flow of blood. Term vaso, pertaining to the blood vessel, constriction, is a reaction to injury in a blood vessel causing narrowing of the muscular tissue at the site of the injury. An enzyme is a substance in the body that speeds up a specific reaction. Amylase, lipase, those are the things that help speed up digestion, just to name a few. Thrombin is an enzyme in plasma that helps control platelet response. Primary, in first stage, hemoblood stasis, is the first stage of hemostasis, concluding with the formation of a platelet plug. There's actually a lot of factors that go into forming a blood clot, just then platelets coming together. Fibrinogen is a protein associated with blood clotting. Very important. Fibrinogen is turned into fibrin when injury occurs, creating a mesh with platelets to stop bleeding. As we mentioned before, fibrin is a protein that cannot be dissolved. It forms a mesh with platelets to stop bleeding when injury occurs, sort of like a spackling and paste job on a broken wall. A hemostatic plug is the mesh of fibrin and activated platelets, the brick and mortar, so to speak, formed at an injury site. Now, your secondary hemostasis is the second stage of hemostasis, concluding with the formation of the hemostatic plug. And then finally, once everything heals, you have a process called fibrinolysis, the breaking down of fibrin as the injury heals. Plasmin is an enzyme that plays a vital role in breaking apart fibrin as the injury heals to facilitate fibrinolysis. A clotting factor is the blood protein involved in the process of blood clotting, and there are several of them. A coagulation cascade is a series of changes in the body to prevent blood flow while also avoiding unnecessary and dangerous excessive clotting. It's a whole series of steps. One leads to another, that leads to another, almost like a chain reaction. And some of these reactions also help keep each other's in check and balances. Hemophilia is a disorder, a genetic disorder, that can cause excessive bleeding, even from the minorest of injuries. Thrombophilia is a disorder that can also cause excessive clotting. A thrombus is a clot formed within a blood vessel. Now, this is something that's pretty serious. A pulmonary embolism is a blood clot in the lungs. It's a very potentially deadly disorder, and many often, or most often, not recognized. In phlebotomy, an additive is a chemical agent that affects how blood can be processed and tested. The liquid portion of the blood that has been allowed to clot is known as serum. It's distinct from plasma and does not contain any of the proteins such as fibrinogen. A whole blood specimen is an anticoagulated blood specimen that has not been separated into solid and liquid components by spinning or centrifuge, or by any mechanical activity. The buffy coat is the middle layer of an anticoagulated blood specimen that has been spun in a centrifuge. A centrifuge, we haven't mentioned it before, is a device that spins around at high speeds to separate the plasma from the formed elements. So the buffy coat is the middle layer that contains white blood cells and platelets. So as you can see in the previous definitions, blood vessels are lined with natural anticoagulants to prevent inadvertent thrombosis. When the lining of a blood vessel is disturbed, hemostasis repairs the injury while maintaining blood flow to the rest of the circulatory system. At least in a perfect world. That's not always the case though, especially in cases of myocardial infarction or heart attack or stroke. When tissue outside the inner lining of the blood vessel is exposed to blood, hemostasis is also triggered. So, if you take a look at this diagram to begin with, there's some injury to the epithelial lining of the blood vessel, and the blood vessel automatically begins to constrict. The smooth muscle within the lining of the blood vessel begins to contract, and it narrows the lumen of the blood vessel to help slow blood flow down to allow your platelets, which you don't see in this diagram, to collect to that area. And then in the second phase, now the platelets start collecting into that injured area, and they start plugging up that defect in the epithelial lining. And as you can see, those platelet plugs are starting to form little bridges to attract other platelet plugs to complete the process. During your third stage of hemostasis, you have a platelet/fibrin plug formation, and this is the point where the platelets send out chemical messages to attract other platelets, and they start reaching out and really developing this network of interconnectivity to help put together a big wall, so to speak, to patch up the defect. So blood clotting is a complicated process, and some disorders are caused by inadequate or overactive clotting. Clotting factors are the blood proteins and enzymes involved in blood clotting. We'll go over a diagram of in class. It is a very complicated process, which by no means will you be required to memorize. The coagulation cascade describes the series of changes that prevents blood loss while also avoiding unnecessary excessive clotting. So it's a constant game of back and forth, checks and balances. Hemophilia, as we said before, is a disorder that can cause excessive bleeding, clotting that doesn't occur as it should. Patients with hemophilia are treated with infusions of clotting factors that they often carry with them and start on their own anytime they experience even the minorest of traumas. Thrombophilia is a disorder that can also cause excessive clotting. Patients with thrombophilia may be treated with anticoagulant medications. There's many on the market. We'll talk about a few of them during class, such as Plavix, warfarin, otherwise known as Coumadin, Effient. These are just ones that I'm rattling off the top of my head that you do not need to memorize, but at some point in time maybe need to be familiar with. Anticoagulant medications may also be used when the patients have abnormal heart rhythms, such as atrial fibrillation, which makes a person very prone to blood clots, or artificial heart valves to reduce the risk of abnormal clotting. Patients who take certain anticoagulant medications may need periodic blood testing, we call INR or PT-PTT testing, to monitor the medication's effects and also to monitor the levels of anticoagulant in their blood system. Phlebotomy technicians must remember certain key points about hemostasis as they work. Hemostasis repairs wounds created during venipuncture and capillary puncture procedures. Applying pressure to the site aids vasoconstriction and speeds the process of hemostasis. This is a basic tenet of most basic first aid class as far as bleeding control. Phlebotomists must ensure bleeding has stopped before allowing the patient to leave. Patients who take anticoagulant medications obviously may require more time for the bleeding to stop, and as such should be monitored for a longer period of time. Blood clotting may be encouraged or prevented in blood specimens depending on the tests ordered. So blood collection tubes may contain additives that promote or prevent clotting. That'll be covered more in the next chapter. Blood specimens collected in tubes without an anticoagulant additive will clot after about 30 to 60 minutes, and subtube contains additives to speed the clotting process. Collection tubes may be spun in centrifuge to separate them into their liquid and solid components. Remember, a centrifuge is a device that spins the test tube at very high speeds to separate the components. And here's some diagrams of some examples of a blood specimen without anticoagulant pre-centrifuge and blood specimen with anticoagulant pre-centrifuge. And as you can see on the bottom, the centrifuge specimen has a serum with no fibrinogen, serum separator gel, and blood cells in the fibrin clot. However, the blood specimen with anticoagulant has been separated into plasma, a buffy coat, whereas the blood cells and the platelets are separated from the red blood cells. Again, that will be covered more detail in the next chapter. There are important differences between serum, plasma, and whole blood specimens. When a blood specimen is collected in a tube without an anticoagulant additive, the centrifuge specimen will contain a liquid portion called serum and blood cells in a fibrin clot. Serum does not contain fibrinogen. When a blood specimen is collected in a tube with an anticoagulant additive, the centrifuge specimen will contain a liquid portion called plasma, the buffy coat made up of white blood cells and platelets, and the red blood cells. When a blood specimen is collected in a tube with an anticoagulant additive, it is tested without centrifugation. This is known as a whole blood specimen. Differences between serum, plasma, and whole blood specimens. Tests related to immunology require serum specimens. Tests related to hematology require anticoagulant specimens, often whole blood. Some tests may be conducted on either serum or plasma specimens. There's too many tests to list in this chapter or in this presentation. And that is your chapter 7 at the end of this presentation. Please go through each slide step by step, read the textbook, and feel free to bring any questions to class as they may come along. Enjoy the rest of your week.